Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'm Muhammad Afiqi bin Ihsan. I'm a specialist in anesthesiology, critical care and pain medicine from University Sultan Zainal Abidin, Uniza, Kuala Terengganu. Distinguished professor, esteemed colleague and respected scholar, today I'm going to talk about the Islamic ethical framework for artificial intelligence and sedation in a critical care, a Maqasid Sharia approach. As an introduction, AI or artificial intelligence is no longer a distant promise. It is a reshaping medicine right now, especially within the intense environment in our intensive care unit ICU. Yet, as every technological advancement, AI brings with it a paradox of the challenges and promising. In one hand, it enables a smarter care, but on the other hand, it generates ethical dilemma that we cannot ignore. As a sedation in the ICU is a cornerstone, as many of you know, in the ICU management, the sedation is very vital and essential, especially for the ventilation, eases the stress, and also to improve the survival and outcome of the patient. Okay, so a delicate balance that we cannot ignore between the analgesia, anxiolysis, and hypnosis in order to give the patient a good comfort in ICU and also the pain stability. Okay, traditionally, this art was entrusted based on the physician judgment and also a monitoring. But right now, we are moving toward the AI, artificial intelligence, based on the AI algorithm as a closed loop system and also predictive analysis. Okay, so AI-driven sedation, as I said, in the closed loop system and also predictive analytics, usually it can prevent from the patient either we want to give her over sedation or under sedation, but it can balance by using this AI-driven sedation. Okay, so the clinical readiness in understanding of AI is no longer as an option. It is a must know, the thing that must know, and also it's very essential for every physician. And as you will all know, that machine learning power is a good because it can optimize the dosing, it can predict what is the complication, and also reduce the risk, especially in the critical care patient in the intensive care unit ICU. Okay, so AI and critical care is very important because it can give a decision, the shaping the decision regarding the consciousness, awareness of the patient, as well as the end of life dignity. So beyond this, they have some important thing related to the ethical, usually in secular medical ethics. It's alone is not sufficient. That's why we need something approach from the Islamic ethical roots, especially based on the Quran, Sunnah, Ijma, Qiyas, and Ijtihad. That's why I came out with this some framework related to Maqasid al-Sharia. Because in Maqasid al-Sharia, we are trying to preserve our religion, life, intellect, progeny, and also wealth. So this is the framework that also a gap that we can see. So far, there is no Islamic framework regarding the AI-driven sedation in intensive care unit. Okay, so the risk is stark. So without value, AI remains, it may erode the faith, dignity, and cultural care. That's why we think this is our first contribution as a first Islamic ethical framework for AI sedation that anchor in related to the Maqasid al-Sharia and also related to the our niyah and also amanah. Okay. So methodological analysis, we integrate the two parallel yet complementary stream. The first one is an ICU sedation clinical pathway analysis that augmented by AI-driven decision support scenario. And second one, an Islamic legal framework grounded in Maqasid al-Sharia. Okay, let me illustrate a little bit about the ICU sedation clinical pathway analysis that augmented by AI-driven decision support scenario. Okay, we know that there is very complexity in the ICU sedation. Okay, the clinical pathway analysis in ICU sedation, they have a lot of things that against the AI-driven decision support. So Islamic, consequently, there will be a mismanagement whether we want to give under or over sedation. This thing associated with the higher mobility, prolonged ICU stay, and also long-term cognitive deficits. So with this limitation of current practice, the definition and assessment of tool regarding the optimization of the sedation, usually we have a lack of uniformity with the over-sedation being a most prevalent thing that occur in our intensive care unit. So with the guideline and practice gap, that despite the evidence based on the pain, agitation, delirium guideline in 2018 recommendation, it routines into the clinical practice as we remains limited due to staffing, variability, and patient complexity. So this AI-driven sedation can give an optimization that enable give us as an integrate real-time data, personalize the sedation strategy, and reduce the clinician cognitive burden that will offer the path to a more safer, more consistent sedation management in intensive care unit. So we have three AI-driven clinical support scenario. The first one is a predictive titration model. Okay. The second one is the delirium risk stratification. And third one is a winning readiness optimization. For the predictive titration, where algorithm adjusts dosing in real time, preventing the clinical deterioration before it happens. So it based on the physiological data from the heart rate variability, the EG-derived indices, and also ventilatory synchrony. So this have the adaptive feedback adjustment in order to give a best clinical outcome for the patient. The second one, from the delirium risk stratification, this AI can calculate the probability of delirium, so it gives a charge to the clinician toward the lighter sedation with the non-drug strategies. And lastly, from the winning readiness optimization, this AI will give a patient readiness for sedation winning by analyzing the cumulative sedation exposure, the ventilator synchrony, and also the spontaneous breathing trial predictors from the patient. So this will give a support the timely liberation from the sedation and also reduce the ventilation duration. So from the Islamic legal framework that grounded from the Maqasid al-Sharia, AI in sedation requires dual grounding, means we have to combine between the modern or from the medical aspect of the ethical, and also we want to combine from the Maqasid al-Sharia. So this is not only clinical justification, but also reverse the ethical and legal legitimacy. Okay, so the Maqasid al-Sharia as a guiding framework, it provides a purposive and holistic paradigm beyond the literally legal reading. So we have a five high objective of the Maqasid al-Sharia. Okay, the first one is Hifz we preserve the religion, so ensure the patient retain capacity for worship whenever is possible. The second one gives the nas, preservation of the life. So we prioritize the survival and physiological safety for the patient. The third one is al-aql, preservation of the intellect. So we avoid any unnecessary cognitive suppression or delirium, and fourth one is a hifz al-nasal, preservation of progeny. So we're protecting the any maternal or fetal or baby related safety, especially during the pregnancy. The last one is the hifz al-mal, preservation of wealth, that what we advise regarding the affordable and what can be the good financial support, assessment, or assess to give a good safety to the patient. So this is a graph regarding the foundation of Islamic law. So we have to preserve the wealth, preserve the religion, preserve the progeny, preserve the life, and also the intellect. So this is the finding or some discussion regarding the Maqasid al-Sharia sedation AI metric that we call it as a MSA metric. We map this principle into what we call the Maqasid sedation AI metric MSA metric that integrate the five axis mapping where each Maqasid directly informs sedation related decision making. So we have five preservation or five Maqasid Sharia: the religion, the life, the intellect, the wealth, and also the progeny. So based on the clinical sedation scenario, for example, in the religion, sedation in conscious Muslim patient, so AI decision notes regarding the prayer-friendly sedation schedule. So from the Islamic ethical directive, we have to facilitate the patient ability to perform the prayer every time when there is a prayer time. Okay? For the preservation of life, for example, sedation for unstable patient, usually we use a BIS target setting. So in Islamic ethical directive, we want to prioritize the life-saving sedation over the procedure delay sedation. So this AI suggests the immediate propofol infusion for severe ARDS that override, that allow if hypotension threaten the mortality. Okay, the third one is the preservation of intellect. So based on depth and duration of sedation, we can have some titration from the AI decision. So in Islamic ethical directive, usually we avoid unnecessary deep sedation in order to preserve the cognitive function. So this part of the thing that we need to know in order to preserve the intellect. Hifzul Aqal. The next is a Hifzul Mat, preservation of wealth. Sedation usually costly, increase the use of the drug itself and also the machine. So the sedation cost effectiveness and also resources stewardship. It can use based on AI decision. So from the Islamic ethical directive, it justify the justice, equity regarding the resources. So the AI shorten the ICU stay by guiding this timely sedation winning and also reduce the overall hospital stay and cost. Lastly, the preservation of progeny, Hifzun Nasl. Okay, so from the Hifzun Nas, sedation in pregnant, especially in pregnant in ICU, so the drug selection algorithm, in order to follow the Islamic ethical direction, so we have to use a minimized teratogenic sedation agent. That's why in AI, we have to prioritize using a dexmedetomidine over the benzodiazepine, okay, benzodiazepine in a second trimester, especially in ARDS case. Okay. So this ethical safeguard in AI supported sedation, the mapping, having a three mapping critical inflection point where the Islamic ethical can enrich regarding the AI decision making. So the first one is AI bias mitigation. So it allows or ensure the algorithm fairness by including the Islamic end of life ethic in AI training datasets. The second one is a consent pathway integration by embedding the family consultation and also the concept of meeting or discussion, which is shura, in AI's recommendation steps before irreversible sedation decision taken. The last is decisive principle, easy way. We are applying the Islamic principle of facilitation, taisir, to reduce the patient suffering without violating haram boundaries. So it's within the Islamic concept or Islamic framework. Okay. For the practical application in ICU, we have three scenarios here. The first one is agitated, mechanically ventilated Muslim patient. So AI suggests a deep sedation due to persistent ventilator asynchrony. But in our ethical framework, it overrides by the limit sedation depth. to maintain the intermittent alertness for the spiritual needs unless it's physiologically unsafe. For the scenario B is an elderly patient with poor prognosis. So the AI recommends prolonged midazolam infusion for the comfort. From the Maqasid Sharia, from the Islamic framework, this override by the shift toward the opiate-based comfort sedation in order to avoid unnecessary suppression of the cognitive and also the facilitating the final act of the worship. And lastly, the scenario C, in pregnant trauma patient, AI select the standard sedation protocol including benzodiazepine, but in the Maqasid guided modification, it replaced this benzodiazepine into the non-teratogenic agent or drugs, despite slightly higher cost and slower onset. So this is the framework regarding the Maqasid and Sharia. So from the Islamic bioethic, parents patient autonomy with divine accountability, we can see there is an individual freedom and also divine accountability, but these three things regarding the beneficent we trust in tools safeguard the life, the patient autonomy regarding the moral agency directed by the accountability, and also the non-maleficent in order to preserve the dignity, acknowledge and readiness for patients end of life care. As a conclusion, we can see AI is a potential in sedation because nowadays it is a very advanced technology. So AI is one of the advanced technology that we must deal with. So we have some ethical dilemma regarding this technology and also the clinical situation and scenario. So this Maqasid al-Sharia integration coming with the MSc, which is Maqasid Sharia Sedation and AI metric framework come up with the five principle or five mapping area. So this is a global model for the responsible AI. I think that's all from me. Thank you very much. Thank you.